Hello, this is Beth here, lead nurse educator at International RN. So I'm an experienced nurse here in the UK, and I have been teaching OSCE and doing overseas recruitment of overseas nurses for about 60 years. I also teach the CBT exam. In 2024 is when I made my own company of International RN. If you'd be interested in taking a course with us, please check out our website. Or if you want more tips and other videos for your OSCE exam or CBT exam, please check out our social media and YouTube channel. Okay, and as always, good luck with your exam.
I'm now going to carry out the implementation station for the OSCE exam. Before I start my station, I'm going to decontaminate my hands using the hand gel. 7 steps of hand hygiene. Fingers interlace. Back of hands with fingers interlaced, nails, thumbs, centre of the palms and my wrists. I'm going to check the environment is safe to approach before I go to my patient's bedside. I'm going to pick up my patient paperwork so I can check my patient's ID. Hello Sally.
Hello.
My name's Beth. I'm one of the nurses looking after you today.
Okay.
I'm just going to prepare your medication in a minute. Do you mind if I just check your identity before I start?
No, that's fine.
Okay, so can you tell me your full name?
Yes, it's Sally Taylor.
Just checking with my patient's wristband, and that's correct. And your date of birth, please.
12th of the 5th, 1990.
And hospital number here is A123456. So it all matches with my drug chart, so I'm happy with that. Sally, are you allergic to anything?
Yes, I'm allergic to penicillin.
And what does that do? What kind of reaction do you have?
Oh, it gives me a terrible rash.
Okay. So I can see here you've got the penicillin wristband, red wristband. That's just to identify that for us, to make sure we don't give you any penicillin. And also the penicillin reaction allergy is recorded on my drug chart. So I'm just going to prepare your medication. I'll be back in a minute. Do you need the toilet or anything?
No, I'm fine, thank you.
Okay. So just going away from my patient, and then I'll prepare my medication again, going to my drugs trolley. I'll decontaminate my hands with the hand gel because I've touched my patient. And then before I prepare my medications, I'm going to just have a look through my drug chart and review it. So the patient's details are correct, which I've checked against her wristband and checked with her verbally. She's also got the penicillin allergy, which is documented there. Has been signed by the doctor, and I can see here her height and weight has been completed. So these are kind of normal height and weight, so I'm not concerned about those. Obviously I would note if I had an underweight patient, because I might need to change some of the medications doses or ask the doctor to change them. So moving on to the once only and stat doses, she's had IV morphine at 2 o'clock, which was given by nurse KS. She hasn't got any oxygen prescribed, but she doesn't appear short of breath or anything, so that's fine. PRM medication, she's got Oromorph, which was given today by nurse KS at 5 o'clock. Salbutamol inhaler, which again she was given at 5 o'clock by nurse KS. Moving on to the antibiotic section, she's prescribed penicillin, 500 micrograms QDS by Dr. Bird. I noticed that she's allergic to penicillin, so I'm not going to administer that. I'll just leave it for now and I'll come back to it. She's also got Oromorph prescribed, which is prescribed 5 times a day, and it's prescribed now at 1600, but she's already just had some, so I'm going to omit that again. She's also prescribed salbutamol inhaler 5 times a day, 100 to 200 micrograms. Again, she's just had that an hour ago, so I'm not going to give that now. She's also prescribed metoclopramide tablets, which are 10 milligrams 3 times a day, and 1 is due now. I noticed the doctor's signature is here as well as his bleep number, so I will prepare that. In addition to this, she's prescribed IV fluids of normal saline, going at 125 mils an hour, and I will check that. Okay, so I'm going to start dispensing the medication now. So I'm just going to grab a pen, because I forgot it. So I've already checked this, no stat doses or PRN medications can be given now. Penicillin, I'm going to omit this because she's allergic to it. So I'm just going to sign, and also I'm going to put the code, which is number 2, omitted for clinical reasons. And I'll make a note of that on the back of my drug chart in a minute. The Oromorph, again, I'm going to admit that because she's already had that. And I'm going to choose an appropriate code, which would be omitted for clinical reason, again, number 2. And the same with salbutamol. I'm not going to give that because she's already taken that at 5 o'clock along with the Oromorph, so I'm going to omit both of those and put 2, omitted for clinical reasons. I'm now going to dispense the metoclopramide. So my drug trolley has been locked and it's also clean. So I would unlock that. And I would get my metoclopramide. So here I've got metoclopramide 10 milligrams tablet, expires 2029, and my patient requires 10 milligram orally, so I can give her 1 tablet. Lock my drug trolley. Also, she's got IV fluid running, which I'm going to check as well after I give her the tablet. Okay, Sally. So I'm back with your medications now. Do you mind if I just double check your identity again?
Yes, of course.
So can I have your full name?
Yes, it's Sally Taylor.
And your date of birth?
It's the 12th of the 5th, 1990.
Lovely. And hospital number is A123456. That matches my paperwork here. Okay, Sally, I've got an anti-sickness tablet here for you. I'm not being able to give you your painkillers at the moment because you just had some an hour ago. How is your pain right now?
Oh, I've still got quite a lot of pain, yes.
Okay, on a scale of 0 to 10, with 0 being no pain at all and 10 being the worst pain imaginable, how is it?
Oh, I'd score it a 6.
Okay, so what I'm going to do is after I finish here, I'm going to go and have a chat with the doctor and see if he can give you some more painkillers.
Okay, that'd be great,
Okay.
thank you.
Also, the doctor's prescribed some penicillin, but don't worry, I'm not going to give that to you. I'm going to speak to him about that and ask him to prescribe an alternative antibiotic for that.
Okay, thanks.
Okay. So I've just got the metoclopramide, which is a sickness tablet for you. Is that alright?
Yeah, that's fine,
Are
thank
you
you.
able to swallow this?
Yes, I can.
Okay. So assuming my patient's taken their tablet, I'm now going to gel my hands and then I will check her IV fluids. So I've got normal saline here, and this is a bag of normal saline, 1 litre, running at 125 mils an hour. If I had an IV pump running, I would check that's at the right speed. And the batch number is correct, the same as the paperwork here, and it was started at 3 o'clock, so that's correct. And also we would check the cannula side that it's painting and that the fluids are running and there's no signs of infection or swelling or anything like that, so I'm happy with that. Okay, Sally, do you have any questions for me?
No, not at the moment, thank you.
Okay, are you comfortable at the moment?
Yeah, not too bad.
Okay. Well, just give me a ring if you need anything. You've got the bell there, and I'm just going to carry out my paperwork.
Okay, thank you.
Okay. So I'm happy now I've given all my medications, just to complete my paperwork. So I'm just going to sign the metoclopramide I've given. And on the drugs not administered section, I'm going to complete that. So firstly, I didn't give the penicillin. And my reason why is the patient is allergic. I also didn't administer her Oramol, so I'm going to write that down. And the reason why I didn't give that is she already had it an hour ago. I also omitted her salbutamol inhaler, so I'm just going to write that down again. Okay. So I'm happy that I've completed all my paperwork now, and I've finished my station. So I just make sure my drug trolley is locked and decontaminate my hands before I leave.